As part of emergency training, medical assistants should be ready to respond to an adult with an obstructed airway. A bolus of food is the most common object adults choke on. When the food is lodged in the upper airway, the person may put his or her hands around the throat, the universal sign of choking. If the person can wheeze, make a high-pitched sound, cough, or speak, do not take any action. Instead, call 911 and encourage the person to continue to cough forcefully to try to dislodge the object. If the person is unable to speak or cough, he or she is in immediate danger and action must be taken. Materials needed to demonstrate proficiency in this procedure are an approved mannequin, gloves, and a ventilation mask with a one-way valve for unconscious victims. Once it has been established that the victim is choking, direct someone to call 911 and say clearly and loudly, "Are you choking?" or "Can you speak?" If the answer is no, as indicated by a head shake, tell the victim you are going to begin emergency treatment. For demonstration purposes, a coworker will simulate a victim in need. Stand behind the victim with your feet slightly apart, placing one foot between the victim's feet and one to the outside. This stance will give you greater stability. If the victim should pass out, you can safely guide him or her to the ground by sliding him or her down your thigh. Place the index finger of one hand at the person's navel or belt buckle. If the victim is a pregnant woman, place your finger above the enlarged uterus. If the person is very pregnant and the uterus is pushing the stomach and other internal organs under the ribcage, you may have to perform compressions. Make a fist with your other hand and place it, thumb side to the victim, above your other hand. Place your marking hand over your curled fist and begin to give quick inward and upward thrusts. There is no set number of thrusts to give to an adult who remains conscious. Continue to give thrusts until the object is removed or the victim becomes unconscious. If the victim becomes unconscious, gently lower him or her to the ground and put on gloves if available. A CPR mannequin will be used for the rest of the demonstration. Before administering rescue breaths, open the airway with the head tilt chin lift and look for a foreign body in the victim's mouth and remove if visible. Blind finger sweeps are no longer recommended and should not be performed. Immediately begin CPR with 30 chest compressions and 2 rescue breaths. Use a ventilator mask if available. Continue with cycles of 30 compressions and 2 rescue breaths until the foreign body is expelled or advanced medical personnel arrive to relieve you. If the object has been successfully removed and the patient did not lose consciousness, the patient may feel he or she no longer needs medical treatment. As a rescuer, you must insist that the victim seek medical attention anyway. The lodged object may have caused swelling in the lining of the esophagus, constricting the throat and impairing breathing.